Hey, everybody. Excited to be here with y'all at the Single Payer Conference with Healthcare Now. My name is Aija Nemer-Aanerud. I use they, them pronouns. I'm the Healthcare for All campaign director at People's Action. We're going to be talking about long-term strategy to get to Medicare for all in this session. And before we get kicked off, I want to take a moment for all of us in this discussion to introduce ourselves, about a little bit about ourselves, as well as a little bit about our organizations, so folks watching know who we are, what we do, why we're here. As I mentioned, I'm with People's Action. We are a network of 40 community organizations in 28 states. The community organizations that are affiliated with us are organizations that work on economic, racial, environmental, gender justice. We've got reps from a couple of those organizations here joining us today. Yeah, and we've got a long history, all that kind of stuff. You can Google us. I think with that, I'll pass it over to, I'm gonna go to Ken.
Hey everybody, my name is Ken Whittaker. I'm the Executive Director of Michigan United, the Michigan People's Campaign. My pronouns are he, him, his. Michigan United is a 501c3 in the state of Michigan, of course. We're a statewide organization. We organize on criminal justice reform, environmental justice, public health, healthcare, as well as movement politics. We train people to run for office so that we can have a more representative democracy. Michigan People's Campaign is our 501c4. That's our huge advocacy and lobbying arm. We also drill down on direct actions across the state and teach people the leadership potential that they have within them so that they can take agency in changing their lives.
Hell yeah. Thanks, Ken. Let's go to Michael.
Hi, folks. Michael Lighty, he, him, based in Oakland, California. I'm a member of the People's Action Institute board. I've had the pleasure of working with People's Action for over a decade now at this point, and am part of the healthcare cohort for them. On a daily basis, I'm president of Healthy California Now, which is a single payer coalition in California. And I've been a longtime Medicare for All activist nationally, where I worked for California Nurses Association, National Nurses United for about 25 years.
Awesome. Thanks, Michael. Ben?
Hey, everybody. Ben Chin, he, him pronouns. I'm the deputy director at Maine People's Alliance. We're a multi-issue group, and single payer is probably the issue we've worked on most over the course of our history. When I started as a canvasser for MPA in 2005, I was knocking on doors for single payer. So looking forward to winning it with all of you.
All right. And Megan, last but not least.
Hi, all. I'm Megan Essaheb. I use she, her pronouns. I'm the Director of Federal Affairs at People's Action. I support Aija and the team on the Healthcare for All campaign. And I've been advocating in front of Congress on progressive issues for around 10 years.
Great. We got an all-star team here to talk with you today. Hopefully you feel that way as you watch as well. So in this discussion, we're going to be talking about thinking in the long term and thinking about strategy and thinking about tough choices and all that stuff in service of getting us to Medicare for all. As I mentioned at People's Action, we undertook a process last fall. It involved executive directors, organizing directors, everyone who's here on this screen with you today. So we're going to be talking in this piece about long-term strategy. As I mentioned in the kind of top there, we undertook a process as People's Action in the fall of last year to start grappling with questions about how we actually get to Medicare for all. Yeah, I think all of us are clear that that is an imperative if we're actually going to have a healthcare system that works in this country for delivering care to people and prioritizes that over profit. It's the only way people are going to actually get the care they need. But I think we all recognize that we're not close to that right now. We're at a bit of a standstill in some ways. And we've got trouble from the health insurance industry, the healthcare industry at large, as well as many folks in Congress, a lot of elected officials. Like, there is not the political will needed to pass this. So the conversations we've been having within People's Action are, how do we actually, like, what power do we have as a movement right now? What power do we need to build as a movement? What are the capacities? Who are the allies we need to bring in? What are the blocks we need to build? And what's our role as People's Action in actually doing that? You know, we can't do everything. None of our organizations can. There's tons of different things that need to be done. We have to make some hard choices about where we put our focus, where we put our energy, so that we can actually do those things well. So these were the questions we were grappling with in this process. And as we were doing that work, some of the takeaways for us were, one, we want to focus on corporate insurers as a target that we are building power related to. So like, the insurance industry has a ton of power, ton of money, ton of influence. Meanwhile, there is an understanding kind of, you know, a lot of people are for single payer, but then when you ask them, you know, are you gonna vote that way? Are you gonna actually take action on that? Do you want single payer tomorrow? They're susceptible to fear tactics from the right about losing the status quo, losing what they have. And so one of the things that we determined is we need to really be highlighting the ways that private insurance, the healthcare industry as it is, does not work for people. And this is what kind of created our Care Over Cost campaign that I'll talk about a little bit more later. We also decided we need to be really going hard on base building. We need a much bigger base of people involved in this fight, and we need a much more diverse base, racially, geographically, in terms of age, and we need to get serious about how we build that base. And we need to be building with unusual allies, folks who are not already with us in this fight, even some folks who are maybe not with us on every issue, if we're going to really get serious about winning. So those are some takeaways, and I'm going to pass it over to Megan to just talk a little bit about what are some of the barriers that we're facing to ground all of us in kind of the same info when we think about Congress and Medicare for All, and talking more about what motivated us to take this work on.
Thanks, Aija. Yeah, I can start with a quick state of play of Medicare for All to put us on the same page. Looking at the last Congress, the Medicare for All bill had 122 co-sponsors out of around, there was 220-ish Democrats at any given time. And when they were in the majority, we need 218 votes to get a bill to pass the House. So we're ways off. I think maybe more troubling is that we haven't seen any growth in the last two. We've seen a little growth in the last two Congresses. There were 118 members in 2019, 2020 on the bill. And in the Senate, last Congress, we had 15 senators out of 50 Democrats. And that's the same number as the previous Congress. And actually, Medicare for All Act of 2017 had 17 co-sponsors, so 2 more co-sponsors. I think it's interesting, we lost Senator Hassan last session. She was up for re-election. She did not co-sponsor the bill, which I think speaks to the way she thinks about her electoral politics in her state more than ideology. I think, you know, we face strong headwinds with corporate money in elections, but also like a Democratic Party that persists in perpetuating the fallacy that people with moderate looking resumes are more likely to win close races. And so, you know, People's Action, we believe that's not true. But we have to continue to show that progressive candidates who run on the Medicare for All platform and don't take health industry money can win tough races. I think in 2022, we saw a handful of cases do that, and we really need to, as a progressive movement, like scale that up. But, you know, back to Congress, in theory, we don't need everyone to co-sponsor the bill, every Democrat, for them to vote for it. But, you know, as sort of Aija alluded to, we haven't even seen private health insurance industry really lobby against Medicare for All because they haven't seen it. They don't see it as something that's in the near future or like a reality that they have to spend money opposing. So I think we would, you know, we would gain some Democrats potentially, but we'd also lose some with all that lobbying. The Build Back Better fight last Congress was really instructive of kind of where Democrats are when we had a trifecta. We tried to expand Medicare to dental, vision, and hearing by lowering the age of Medicare to 60. And of course, corporate Democrats, just a handful, but we had thin majorities, pushed back really hard. There's people who take a lot of money from private industry. And then we didn't really, when it came down to what to prioritize within healthcare, we didn't have Speaker Pelosi's support on the Medicare. She was focused on Medicaid money, which of course is very important. But we do have Congressman Hakeem Jeffries is now the Democratic leader in the minority in the House. He did co-sponsor Medicare for All last Congress. So that's progress. We'll see, what that means for this Congress when the bill is introduced. On a brighter note, we do have Senator Sanders chairing the Health, Education, Labor, and Pensions Committee, but without a majority in the House. That's really an opportunity for him to promote a narrative of Medicare for All, and he's already been doing hearings, calling the CEO of Moderna to testify, and so very much using that gavel to promote a narrative in the media around what corporations are doing to people. But just another couple other, to note the administration. The administration seems quite divided on taking on corporate power. They're seeing more interest in them taking on the power of pharmaceutical industry than the private health insurance industry. Though they did just put out a Medicare Advantage rule. For those who don't know, Medicare Advantage is privatized Medicare. We're concerned because it has grown to over 50% of Medicare recipients. But after great advocacy, the administration is trying to rein in the corporate profits in Medicare Advantage. They've been taking advantage of the system, but they put out a proposed rule. And then when industry went crazy and did a lot of lobbying, the Biden administration decided to slow down the implementation of that rule. I think there's a real challenge with neoliberals and people who are really in bed with private health insurance being in health and human services. And so I think I would encourage folks to think about that pipeline as well as the electoral pipeline, that we need to have good people in policymaking decisions, positions in government, because that important policymaking they do in the administration is really a lot less visible than the work that our electeds do, but can be really impactful, and they can have a lot of power based on really their ideology and how they think about the health insurance system. I think with that, I'll pass it back to Aija.
Great. Thanks, Megan. I'm going to pass it over to Michael to talk a little bit about what else you see as the barriers, what else kind of motivated you to take on this fight, this long-term planning work, not the fight.
Yeah, it is a long-term fight for sure. And thanks, Aija. The number I want to start with, really reinforcing what Megan was saying, is $1.25 trillion. That's the revenue for big insurance companies in 2022. And what we have to remember about that number and what Megan said about how they spend it politically is that every dollar comes from us. Either an employer pays it and it takes it out of our wages, or we pay it directly in the form of premiums. And it is, of course, quite extraordinary if you think about it, that we're paying to perpetrate a system that denies us care and that literally kills people. And then politically, how that gets played out, I think, is exactly as Megan said. The overwhelming power of these commercial insurance companies to dictate public policy, even when we think we have them on the defensive, like in the Medicare Advantage fight, we thought, well, okay, we can reduce the public subsidy down to 1%. increase, right? Instead, they end up getting an over 3% increase in the subsidy they receive from the government. Oh, that sounds okay, except when you realize it translates into additional $10 billion. And that's pure profit out of taxpayer money. In fact, most of the insurance companies derive most of their revenue from public sources. And three of them, Centene, Molina, and Humana, derive over 84% of their revenues from public programs. And at the same time, they're developing new structures so that they control the pharmacy benefit manager, which is essentially the middleman in the drug prescription drug industry, and those are controlled by insurers. So they're taking a cut out of that. Every time you buy a prescription now, they get a cut, a big cut. And so this accumulation of revenue means accumulation of political power. And that's what we're up against primarily, is the heavy concentration and also the feeding at the public trough that generates this revenue and ultimately generates their profit. So that actually provides an opening, of course, too, because if they're so dependent essentially on us, right, then that makes them more vulnerable. But we have to overcome exactly the kind of political dynamic Megan talked about. But the good thing is that not only do we have the moral imperative to establish a guaranteed healthcare through Medicare for all, we also have a very strong policy case, and also especially in terms of savings. But most remarkably, we have a very strong public opinion base where, Medicare for all is viewed favorably by 63% of Americans. That's quite remarkable if you think about it. Now, of course, there's a partisan divide there. Republicans oppose it, but you do have, even among Republicans, significant support. And, about a third, those tend to be working class folks in the Republican base. Democrats, strongly favor it, and a majority, really, it's 58% in a Kaiser Foundation, Family Foundation poll I saw. 58% of independents support and have a favorable view of Medicare for all. And the opinion has really shifted in our favor, particularly since 2016, and it's no coincidence. That's, of course, when Bernie Sanders ran for president, emphasizing Medicare for all. So I think that's the other context that we operate in, and I think we should feel good about that. But especially, though, it's relevant to elaborate a little bit on what Aija said, that there is this, what's called in sociological terms, loss aversion, or the fear of losing what you have versus a somewhat unknown future. And so because people's situation when it comes to getting healthcare is relatively desperate, they very much want to hold on to what they have. And that you can see in the statistic for the first time last year, 50% of people in the US deferred or didn't get care due to cost. That is still healthcare costs are the leading cause of bankruptcy. The fact is that healthcare is increasingly a financial burden, and people are very worried about whether they're going to get the healthcare they need. I mean, it's a huge majority. Over 80% of Americans are dissatisfied with the quality of the U.S. healthcare system, the highest number Gallup has ever recorded. And so there's this fundamental concern about the system, fundamental concern about whether people are going to be able to afford the care they need. And at the same time, though, you do see a lot of people say, who have employer-based commercial insurance specifically, that they are relatively happy with their insurance plan. That primarily comes from the fact that very few Americans or people in the US in any given year have a heavy utilization of their health insurance, that have a really severe medical problem. The more severe your need in healthcare, the worse your experience is with health insurance. And so that dynamic is very much an issue when we organize around this. I think a couple final observations. Let's keep in mind that Medicare for all poses a fundamental challenge to corporate power and limited government. And those two aspects are on the ascendancy. There's a lot of folks skeptical of government, and there's a lot of folks seeing the rise of corporate power and inequality and the overwhelming power of billionaires and the wealthy. We also have seen, as Megan pointed out, that the Democratic Party leadership hasn't really been willing to take on the healthcare industry, reform it, actually provide more tax subsidies to health insurance companies, and go after prescription drug costs to some limited extent, but really take on the healthcare industry. But I think perhaps most important is that winning Medicare for all is likely part of a broader political economic transformation and can't be isolated from other economic and social justice demands. And so we have to understand our movement really in the context of a broader movement for social and economic justice and transformation. And that really means movement matters more than ever, and that when we confront the for-profit commercial insurers who dominate the healthcare industry, drive healthcare policy to a large extent, we understand that ultimately we're going to have to build this people power to overcome their intense political influence of their money. And that's really what we're all here about. So thanks a lot.
Thanks, Michael. Yeah, gave us a lot to think about there, a lot to chew on. I think that's a great segue to some of the stuff that I've been talking with Ken about, that I know Ken was bringing up in our long-term planning process. So Ken, I think I'm going to turn it over to you. I'd love to hear a little bit about your thoughts about, like, how are we thinking differently? How are you thinking differently about the work ahead of us, how we approach Medicare for all, how we approach strategy based on kind of the takeaways that we had from this process?
Hey, thanks, Aija. And Michael said it best. We need people power. So through our long-term planning process, we realized that we needed to approach our single-payer movement in new and innovative ways. And basically that translates into going back to the basics and doing what's already worked. So there are a lot of key changes that we need to do in order to operate differently. And that's building power. Power is our problem, not policy. We have the policy works. The issue is not actually having the people power that Mike will talk about to move this. So, our focus should shift, honestly, from solely advocating on policy changes to building power, being in relationship with people, going back to one-to-one communication. We need to create a strong and united front capable of influencing and challenging the status quo. Here in Michigan, we talk about our organizing revival. And that's training all of our organizers, all of our leaders in the art of hand-to-hand combat, we call it. And that's one-to-one conversations, creating a non-judgmental space so we can actually have deep conversations about the issues that are impacting our life. And then we need to wrestle with how we get to a much bigger scale. In order to make a real impact, we've got to reach a larger scale. That means expanding our reach, engaging with more people and organizations. We're going to be organizing across racial and geographic lines. In the past, sometimes we inadvertently limit our scope. But to succeed, we've got to be inclusive and work with communities of all different racial and geographic backgrounds and economic backgrounds, understanding the unique challenges and perspectives through each culture. And then in doing so, we'll organize people who actually don't agree with us right now. And we can do that through enhancing our deep canvas skills, making sure that all of our organizers, all of our leaders are steeped in deep canvassing skills where that they can actually create a non-judgmental space and have conversations with people that actually don't agree with them, share their stories and solicit stories from people so that they can find that common thread that actually drives the conversation further and gives us an opportunity to provide the political education necessary to move people. So to grow our movement, we engage those that don't share our views. We have difficult conversations and build bridges with those that, have different opinions on healthcare reform. Everybody in their family has somebody who is on Medicaid and Medicare. And the thing about that we don't think about, we don't bust our butts trying to get health insurance to cover our grandparents because we know that they're covered. that same security needs to be experienced by everyone in the country, not just our grandparents. So we'll get in much deeper relationship with other organizations, strategically aligning to maximize our impact. Strategic partnerships from with physicians, nurses, medical associations. No, there are many organizations and associations that actually believe how we believe that we can align with before we actually branch out and start to talk to people, from across the lines. And I'll pass it back to you, Aija.
Thanks, Ken. Yeah, if y'all are noticing any like funniness in the transitions, it's because I'm facilitating this and also operating the spotlight. So apologies to anybody watching this who's a little bit confused. But yeah, I appreciate that grounding, Ken. And I'm curious, I'm gonna add in Ben here. Because you were part of this process on long-term planning too, and you're based in a member organization, a place-based organization. I'm curious, as an organizer, like how you're thinking differently about the fight for Medicare for all, coming out of this and about strategy.
Yeah, really appreciate the question, Aija. It's great to be with everybody. I will say one thing that this process has really crystallized for me was the tension that I used to feel between things like single payer and other things like a public option. So I remember back in the day, working on Healthcare for America Now campaign, but also being pretty psyched when Code Pink disrupted the Senate hearings on, that were going on in the ACA. We're pushing for single payer, and and I just remember in that time around the Affordable Care Act, just really feeling tense about, do we push for our big vision only, or do we push for some of this more incremental stuff? And then, when Dennis Kucinich voted for the ACA, I was like, okay, like this makes sense. Glad we did it. And then I think until we had done a strategic process, I had not really given much thought to that tension in between. We got involved in like a lot of defensive stuff in Maine, the Tea Party takeover, we had a big repeal of Medicaid. We had to run a ballot measure to get expansion back. For the last few years, we've been fighting around immigrant inclusion in our Medicaid program. And I think somewhere along the line, I just sort of realized that original tension I had felt between single payer and all these other healthcare fights had just sort of evaporated. And maybe that's just because, Donald Trump, and for us, Governor Paul LePage, and all these other right-wing authoritarian figures, I think, put some of these factional disagreements in perspective, and we kind of had bigger fish to fry. And I feel like in talking with everybody, who's on the Zoom right now, and just like our base and our in-state allies, it just feels like we're in a very different time when people can kind of hold those things together in their heads, that we want to limit the power of insurance companies. We want to expand healthcare access every single way that we can. And that's pushing in the long run for this vision of Medicare for all. And we just have a lot less interest in fighting amongst ourselves around just in general. So I feel really positive actually about what that's meant for us, like on a grassroots level. On like, we used to have meetings with our base where, we would get into fights with each other about all that stuff. And that just full stop doesn't happen anymore, and even with like coalition meetings, allies, conversations we've had with you all on the national level, it just feels like we actually have made some genuine progress there. And I think that we're smarter and stronger and more strategic because of that. And, obviously would have loved it if President Bernie Sanders was passing all of this, as we speak. And I feel like we're much more clear-eyed, now about what it'll take to make that happen. And the reality is, like, we've got a lot of doors to knock on. We've got a lot of volunteers to recruit. We've got to run bills at the state level, at the federal level. There's just not, we can't be too precious, I think, about anybody who's going out there willing to like push hard for this in this direction. Like, that's awesome. You're on the team. Let's make this space as big as possible.
Yeah, I appreciate that, Ben. I might keep you here for a second, actually. Because part of what that makes me think about too is like, like, yeah, we need all that. And like policy, there are important policy questions, but I think the power questions are just bigger in my mind right now. But part of what I'm thinking about as you're talking also is like people who we need to build with they can't wait for Medicare for all. Like they need healthcare right now, right this second. And I think part of why we need to engage in things that are not like the fight for Medicare for all full stop, are that like people actually need care right now. I'm curious like how you're seeing that in Maine.
Yeah, so one of the things that I was moved by and learned a lot from was the conversations that we had with some of our members and allies when we were pushing for the removal of all barriers of immigration status accessing Medicaid. And this is not necessarily a consensus view within the Democratic Party. So even though we had Democrats that control the legislative process, there were some real conversations with people around bottom lines going into that fight. Because, you know, right now folks are undocumented. Back then, folks were undocumented, couldn't get anything. Some refugees could. Some immigrants who had been here for over 5 years could eventually. So people with different statuses in different communities or different countries just kind of were all over the map in terms of what they could access. And everybody wanted to get it for everybody in their community, but people recognized we might not be able to do that all in one go. And the key strategic insight that just regular folks talking to me kind of had that I thought was brilliant was, you know, we're willing to compromise on a lot of things, but we're not willing to get pitted against each other. So what ended up happening in this deal was we won Medicaid access for all pregnant people under 21, all pregnant people and all young people, 21 and under. And that included if you're an asylee, if you're a refugee, if you're a lawfully present immigrant, if you were undocumented, all those categories in those age brackets, and pregnancy status is one. And people recognize that there were, you know, just strategic reasons why we couldn't get everybody off the bat. But they said, you know what, we're not going to buy into this idea that there's like good immigrants and bad immigrants. We're not going to let them do that to us. So like all of our communities actually have to come up together. And I thought that was super clarifying and super simple. We've all got to come up together, you know, across all our different communities. You know, this can't be like an urban thing, a rural thing. I mean, I think the whole vision of Medicare for all, right, is that it's a public good for all of us, right? And that's got to be reflected in the victories that we win. We can't have race and gender and immigration status and nationality, that the right is like core to their strategy dividing us. Like we can't replicate that and how we think about short-term victories. And that's not to say that like we can't make short-term victories and like incremental progress is bad, you know, but it is to say that we're not going to play into the way our opposition's trying to divide us. And that to me was like, oh, like I can get that now. Like I can totally get behind that.
Awesome. Thanks, Ben. I'm gonna remove you here. So what I want to do, we've got like a little bit more time left, is talk a little bit about some of the things that came out of this long-term planning process for us that are both things that make us like hopeful and like new ideas where we're like, okay, this is exciting. I feel like this can work, as well as some of the challenges for us. And I'll kick us off. So for People's Action as a whole, you know, the whole network of all of our member organizations and everything, as we're thinking about our healthcare work, one thing that I'm really excited about, I mentioned to y'all earlier, the Care Over Cost campaign. We do have a workshop happening this weekend on it. Check it out. But this campaign really, it's a marriage of some different types of organizing that we haven't really experimented with before, like kind of bringing mutual aid into healthcare organizing as we're trying to build a base to actually win Medicare for all. So what that's looking like for us is finding people who are experiencing claim denials or just any kind of situation where they need care and they're unable to get it because of their insurance company. You know, I'm sure y'all have experienced that yourselves, know people who've experienced it. It's super common. There's estimates are upwards of 240 million of these instances per year. So we're finding those people. We've got a team of some lawyers, some other experts who are able to help them with the appeals process. And then at the same time, we're also taking public action on behalf and with those individuals to get their claims actually paid and get them the care that they need, get them out of debt, all that kind of stuff. And we've had some really good victories. And what excites me about this is that it's an opportunity to kind of incorporate some new forms of organizing that we haven't used before. I know others have. They're not like new to the world, but new to us. And be able to kind of get people concrete wins right now, meet their immediate needs right now, while building towards this ultimate goal. And while also highlighting the ways that private insurance is failing to deliver what people actually need. So that's just like one example of how we're thinking about, one example of how we're thinking about how to implement some of this stuff that we're grappling with and some of what came out of the long-term planning process. All right, I'm gonna gallery us. And I'm curious, does anybody have any other challenges or like hopes of coming out of this process that you want to raise?
Yeah.
Jump in quickly, Aija. Oh, sorry, Ken, you want to go ahead?
Sure. You mentioned, the Care Over Cost program, which Michigan United is very much involved in. And that's, meeting people where they are, immediate needs. People are getting claims denied, but it gives us an opportunity, like you said, to build base. But it gives us an opportunity to politicize people on the issues that are deeply affecting their lives, right? So like if we're getting our claims denied, we're in bad health, we kind of start losing hope because we're going up against a system that we already know is against us. So with this team of lawyers that are walking people through appealing these claims, but at the same time teaching them why their claims are actually being denied, and it's actually to give more profit to corporations that are already making billions of dollars. So it doesn't matter that you're sick, they're actually still going to walk over your sick, hurt body in order to get that dollar to stick in their shareholders' pockets, and it hits people deeply at that moment where they realize that, geez, I'm being used as a tool to destroy myself and destroy my family. And they've just shown me how I can actually fight back. And I got my claim appeal approved. Oh, this is how it's supposed to work. This is what happens when we all come together. And now I have this higher level of education as to what's happening to me. And then you start to talk to their family, they start to talk to their friends and bring them into the movement. So it helping with these immediate needs truly helps us build base, but not just base, but an educated base, a hungry base, a politicized base that are ready to actually fight for the things that are hurting families.
Yeah, I love that you added that angle, Ken. Thank you. Michael, you have something?
Well, I think it directly goes off what Ken said then and earlier, and also Ben, is that really ultimately that kind of experience opens the door to understanding that this requires a collective political solution, right? And that we can translate, and we need to translate our work building the base and the kind of organizing, the one-on-one organizing that we've talked about, and translate that into political power. And that includes electoral power, because what really gets the attention of elected officials is when they get unelected based on an issue. And if we can really build this base in the way that we're talking about here, then it becomes a real threat to their political future. Because if they're in the pocket of an industry that's doing this to their constituents, that creates a real problem. And I think that, sorry about that. I think that that's a real important tactic down the line when we build sufficient base to be able to operate electorally and translate it into political victories. And so what I would also say is that, we didn't mention this earlier, is that unions and labor is a key constituency for us. Because, of course, they've got relatively good health coverage, but literally every contract, they're sacrificing wages to maintain it. And at some point, that becomes an unsustainable dynamic, and there will be impetus to take it off the bargaining table. And we've got to also, as we build this base, make sure that those union members are a part of it, because no country has won the kind of Medicare for all reform without leadership from the labor movement. But I think even more importantly is the worker upsurge in organizing. There's a huge groundswell of worker organizing for unions. We got to take advantage of that as well and make sure we're connected to it.
I'll jump in. My sort of aha moment with this process was like as we pick what People's Action calls stepping stone campaigns, like our smaller wins along the way to Medicare for All, we're thinking about reducing the power of private insurance. And so I think that's just helpful, also marries with like what Ben was saying, that we both want to help people along the way, but we also want to reduce corporate power. And we can do that like when we get the administration to reduce the profits that Medicare Advantage companies are getting. That's less money that they can spend on elections. That's less money they can spend on advertising. That literally reduces their power. And so there's fights at the state on claims denials. You know, we'll be looking at policy fights that just will reduce their profits over time, as well as toxifying them in the public narrative.
Awesome. Ben, are you off mute? You talking?
Yeah, I toss out. I totally agree with all this, and just one other point of optimism and base building, guys, I put out there is that, you know, comparing where we are now to say where we were earlier when we were trying to pass Medicare or immediately after, you know, there was this old idea that's still embedded in the Medicare system that you have to earn your benefits to get them. So you got to pay these like pseudo health insurance premiums, but to the government, you know, through payroll taxes to qualify for it. And that idea, you know, it carries with it a lot of that deserving and undeserving stuff that we were just talking about. Like there's a set of people who don't have the money to pay in, and therefore they don't get it. And excuse me. And the thing that I feel like is really notable of everything that's happened since the financial crisis, if you look at the Affordable Care Act or the structure of the Green Mountain Care Plan that Vermont passed that didn't quite get implemented, or all the victories in Medicaid expansions and Senator Sanders' Medicare for All bill, none of them have that idea. They're all paid for through progressive taxes, and we're much more interested in this idea, which I think you can really build a base around much more successfully, that we're going to get to everybody having this public good through tax fairness by the wealthy and big corporations paying their fair share. And we're not trying to divide people up into the deserving and the undeserving and play into these racist, classist, sexist myths about why people are poor and don't have as much money and therefore shouldn't access as good of stuff. Like this is a human right. And I feel like the campaigns in the healthcare world have really just led that concept of like public goods should be human right. And we're seeing spillover effects beyond healthcare into childcare and all sorts of other places, you know, long-term care. I mean, these things are all connected, but there's no question in my mind that there's a big worldview shift that's happened in our culture around that because of all the movement work that's being done. And that makes these policies much closer to the reality of people's lives, where they're just like, we just want this, we just need it. Like we know we live in the richest country in the world. Like there's money there to pay for it. Just the people with the money need to cough it up. Like that's where we're at. And like you can knock on a door and sell that way better than some complicated, you know, social insurance scheme.
Totally.
Can I hop back in, Aija?
Yeah. I'm gonna close out soon. Go for it.
All right. One of the, another challenge, you know, being in Michigan, a very, very unionized state, like pro-union all day long, help organize workers. But we know that we have corporations that will literally use unionized workers against us because after bargaining for wonderful health care at the cost of reduced wages, then we create another class of health care. So we're getting pitted against each other. It's like, I don't want to let go of my quote unquote Cadillac plan, or I don't want to let it go of my good health care. But then with the swell of worker organizing that I believe it was Ben, it might have been Megan that just spoke to, you know, now we have a lot more trusted messengers to actually deliver the message that if healthcare is covered, there's more money for your wages, the wages that you've been having taken from you, contract after contract after contract. The healthcare has become, you know, something that is used as is probably the biggest wedge in our movement that could pit us against each other, you know. But being able to, as we talked about, strategic alignment with other organizations, organizing with labor to actually organize workers to fight for Medicare for all. And, you know, a long-term advantage of that is increased wages and contracts. I just wanted to make sure that we lifted that up as a challenge.
Anybody else try and get in here before my last words? Okay. Yeah, we've been having these conversations for many hours previously in the fall, and we're obviously still excited to keep talking about this stuff. So my appeal to y'all who are watching this is to please have these conversations within your organizations, with each other, with us. We are in need of more allies in this work who are having these kinds of questions, right? Like thinking about, okay, what power do we have? What power do we need? How do we build it? What's our role? Because the more that we are all clear about that, the more of us who are clear about that, the better chance we have at actually winning and like having a plan that is strategically sound, whether that'll actually get us there, right? I think we all have a different part to play in that, and we should all get clear about that. So excited about this, really grateful for y'all's participation in both this and the process we've been doing previously. Speaking to the speakers here, and yeah, I think that's it. Thanks y'all for watching.
Thank you.
Thanks all.
Bye.